So then what did I do? Well, I would either ask a friend for help that I knew was on the same thing because it would be like Sunday and the
Mm-hmm.
pharmacists are closed. Like I literally felt like an addict during these times. Like
Mm.
if any description would be that, like I'm dope sick and I'm searching for friends to give me a hit, right? Like
Yeah.
that's the way I felt.
So I have been having a lot of professionals on, and you are just that, a
Truth.
psychotherapist
Yes.
specializing in addiction. You have worked in max security prisons. You
Hmm.
have a lot of experience. You've seen it all,
And then some.
and then some.
Hmm. Yeah.
And you were telling me as right before we were about to go live about your journey with SSRIs, which I definitely want to jump into
Yeah.
because I talk about this all the time in all of my episodes.
It's a huge
Drug,
topic, especially in the addiction community right now.
exactly.
Hmm.
Drug addiction, alcoholism, gambling, sex addiction.
Yeah.
Those are the symptoms. It always ties back to the mental health. Always.
It does. And if we want to get real, I believe the addiction population is the next population moving into psychiatric medication dependency then.
Oof.
So, I'm sure you've talked about it, you've seen it. You come out of
Mhm.
inpatient rehabs, whatever, and you're suddenly on a stack of psychiatric medication. Yeah. He
I'm a
raises his hand.
product of that.
Yeah. And that's a problem. That's a problem. And I think it's a problem in the addiction world because they're not talking about it the way the mental health world is talking about it yet.
Mm.
Because I believe the addiction world is still talking about it as the solution still. And that's where a lot of people in just the mental health side of things are becoming trapped. So, yeah.
Do you think the reason for that is because they feel like a patient who is addicted to drugs is so delicate and it's like, let's play damage control, get them on
Ye-
meds to stabilize them because it's not as evolved as the mental health
That's true.
space.
Stabilize is a interesting term. What is stabilizing? I think getting your brain back to homeostasis is stabilizing.
Mm.
I think we forget in the addiction world and in the mental health world that we have neuroplasticity, right? The brain has the ability to recover and to heal. You see that in TBI patients, traumatic brain injury patients, or stroke patients. Does a stroke patient ever come back to complete zero or normal, typical functioning? Sometimes yes, sometimes no, depending upon the stroke, right?
Mhm.
Same thing with the TBI. But I think when it comes to addictions and mental health stuff, we forget that the brain can heal and the
Mm.
brain can relearn new things. But I feel terrible for the addiction folks right now because they're being left out of the conversation. They're being presented as psychiatric medications are they're obviously a better option than street drugs.
Yeah.
I mean, ish,
Yeah.
right? But they're being presented as if your brain is broken and this is the solution for your broken brain
Mm.
instead of the solution being, let's heal your brain.
Yeah.
Yeah.
I was on SSRIs. I was on Lexapro and Wellbutrin for probably 7 years, and I didn't feel any feelings. I was just numb.
That's just it. That's the whole thing. And some people will argue that that's the point,
Mm.
right? Like, do you want to feel anything? Well, maybe in the early stages of recovery or whatever it is, like the answer to that is no, I don't want to feel. Because big feelings got me into big trouble,
Yeah.
big feelings made me use to get rid of those big feelings. But the flattening, the emotional blunting, and also sexual dysfunction. I don't know if you've talked about this too
Yeah.
much. Sexual dysfunction, PSSD, post SSRI sexual dysfunction, for some people can be a forever journey.
Mm.
So the loss of libido, the loss of feeling in genitalia, the loss of pleasure principles in life, like all of those things can happen while on SSRIs. That emotional blunting will do that. I
Mm.
bet you were less likely to be driven sexually perhaps during that
Mhm.
time. But for some people, it's forever. And you're giving that part of your life up forever. And you don't know it because nobody told you ahead of time that that could be the outcome for you.
Yeah.
And that outcome it destroys people.
Yeah.
Mhm.
During those 7 years, yes, it
Same.
sex drive went down significantly, and it was a lot harder to, perform and stuff like that, like to
Yep.
get aroused and
Yes.
stuff like that. I mean, it was still there, but it was harder. But then
Like a
once
wet blanket thrown over you,
right,
probably, and
but
you can't get out of the wet blanket very well. Yeah.
exactly.
Hmm.
But once thank God I didn't have, longer
Forever.
effects.
Now
Exactly.
think about these.
I felt like a 20-year-old all over again.
Yeah. Yeah, if you think about, kids getting on these medications, because kids are getting put on antidepressants at an
Mm,
alarming rate right now. Let's just say a 15-year-old, if okay, fine. If you're saying, well, my 15-year-old son will give up his sexuality to not be depressed at 15, I might sign off on that because I'm so worried about his mental health, right? But if I would to know that that could have been a permanent outcome for him,
mhm.
I might have thought differently, and I bet that my 15-year-old son would never sign off on losing his sexuality at
Right.
15, you know?
And this is just one effect of many.
Oh, this
This
is
is just
one.
one. Right.
And people will argue, I'm sure they're gonna put it in the comments like, "That's so minimum, that's rare, that's" it is not. There are organizations dedicated to this. They're researching this stuff right now
Yeah.
because the more it's prescribed, the more you're gonna see it, right?
Mhm.
So the less it's prescribed, the less you're gonna see it. The more it's prescribed, and it is prescribed, was it like 1 in 4 people or 1 in 4 women for sure
Is that right?
are on
Wow.
SSRIs, yeah.
Oof.
I'm pretty sure that's the
Yeah, yeah,
stat,
yeah,
yeah.
yeah. Well, so, okay, let's take a step back.
Mhm.
How did you get into becoming a psychotherapist? Was it
Psycho is the biggest part of that statement. Mhm.
Give us the story.
Mhm.
Give us the overall background. One thing I've learned in my own recovery is that you can't do this alone, and you don't have to. I know that firsthand. I went through inpatient treatment at Karen treatment centers, and it changed the course of my life. That's why I am proud to announce that I've partnered with Karen. For nearly 70 years, they've helped people and families not just break free from addiction, but actually heal and transform their lives. They're in network with all major insurance providers, and same-day admission is available. So if you or someone you love is struggling, don't wait. Call Karen at 855-352-0103. That's 855-352-0103. Help starts with taking that first step.
Well, it's weird because it's not a huge, I wanna save the world story, right? So, I've been an entrepreneur my entire life since I was 26 years old forward, and, when I met my husband, who is sitting in the room with us right now, um
He was about to actually walk out, and then we were talking about sex drive, and he's like,
it's like, coming back, I
let
gotta come back in for
me
this
hang out for
conversation.
this.
Yeah, exact. There's more to that story that we could talk about too. Anyway, so I started having my own children, and we opened up daycare centers. At one point, we had 3 daycare centers going at the same time. And then our last child was born, and I knew that my kid would eventually phase out of needing daycare, right? So all the kids would have been out. So what was I going to do with my life? And I thought, I do like working with people, not kids so much anymore. Like that was a long trip with kids, right?
Mhm.
But I really liked that. And I really liked the ability to be an entrepreneur. I didn't know what it was going to take, to get to that place.
Mhm.
So I went back for my master's degree. And so I went back for my master's degree when I had a 1-year-old, a 7-year-old, and 11-year-old. And by
Wow.
the time I graduated with my PhD, because I went master's straight to PhD, I had a 10-year-old, a 16-year-old, and a 21-year-old. So
Wow. 9
yeah.
years of schooling.
9 years, yeah, about 9, 10 years, yes. Now, during that time, I needed things like practicums, right? And then you needed post-licensure hours and things like that,
Mhm.
which led me into my work with the prison systems. So
Take us through the work. That's the juicy part.
that
I want it all.
everybody wants to know about that part, For me, it was interesting because I grew up in criminal justice. My dad was a police officer and chief of police and things like that. So this wasn't as unusual for me, but it was working on the opposite end of things, right? He thought it was pretty cool.
Mhm.
I got my practicum because 3 other practicum placements. So practicum is what you have to do when you're in school,
Mhm.
right, to reach certain hours.
It's like a residency
It's
type
kind
of
of a
deal.
residency,
Yep.
yes. And then, anyway, so I was trying to get into a hospital, and they said yes, and then they said they didn't have the staff, and so Like 3 of them fell apart, and I'm online just in a desperate, like, move, and I'm like, "Department of Corrections. Okay." Sending it off. And of course they said, "Yes, you can come in whenever you I was like, "Oh no, here we go." Anyway, so I'll never forget, it's like my first week there. And this is maximum security. So there's a whole unit. It's called Psych Services Unit. And so they come to your office. Okay. So in that setting, you didn't come to them unless they were in segregation. They came to you. And my first week there, and one of the inmates got into a fight with an officer on our unit right outside my office door. Listen, I'm a little intern practicum student who is like, "What is going on here?" And they're fighting outside of my office window. Like I'm like looking out this tiny little window like this going, "What the fuck? What am I supposed to do now?" I had no idea. Anyway, so they're fighting. I peek open. There's a whole row of psychologists standing right over there and I'm like, "What do I do?" And they're like this, "Come here." And I'm like, are you kidding me? They're literally grappling on the ground right here. Before you know it, there's like 5 other COs coming and they're all fighting right outside my door. I'm sitting inside. I locked the door. I locked myself in and I'm like just sitting there going, "It's going to be okay. This is week 1." And I
Yeah.
thought this is going to be a disaster.
Uh-huh.
Well, it turned out to be a really interesting place to work. And so then I was also doing sex offender groups and things like that, which I never ever thought I would do. Those guys don't even realize their pasts are created who they are. They have no idea.
Mm.
But I also remember, keep in mind at this time, I think my youngest was like 3, 4 years old when this was going on. And so the psychologist that was in charge of the group said, "Read all these guys' files. Read all of them." She brings me this big stack of files. "Read all of them before you come into group." Literally, I'm reading about all the sex crimes that were committed against kids and things like this. I'm sitting in my office again, bawling my face out because I'm like, I can't. And I said to her, I said, I don't think I can do this. This is not for me because the stories were so intense and all I kept doing is transferring my own children into the picture, right?
Mhm.
Into the stories. And then you go into group and you sit down and you realize that these are people, right? These are people and people are bigger than their crimes and they have histories, right? And every history is so unique. You begin to, this is going to sound weird, like have compassion for them as people, right? That doesn't mean that what the crime they did wasn't horrific, right? So
Mm.
we separate the person from the crime. The other thing that I learned working there was most people get out. Most people get out of prison no matter their crime. Some people are there for life, but that's not too many people. They get out. So I learned that I could be their neighbor, right? I could be their neighbor, you could be their neighbor, and the way I treat them is going to almost dictate how they move about society. And I thought to myself, like, they've never been treated with compassion or probably a level of dignity in their life. So that became kind of my mission. Like, that was my thing to treat these guys with compassion and dignity and be a really good listener to them and understand what their needs are because they could literally move next door to me
Mm.
when they get out. And so when I say next door to me, that means next door to you, next door to anybody who's listening, right? So instead of treating people with disdain for what they've done, we begin to learn how to respect their stories.
Yeah.
Yeah.
Listen, I get it. It's your job,
Mhm.
right? And you're going to
So
be doing
hard.
that job regardless. So
Yeah.
why not look at it
Well, my
as
job was never to punish them. They were already being punished.
right, right. Or you could just sit there and not even listen and just go through the
Mhm.
motions. But you
Mhm.
chose to take this route
Yep.
of bettering society and looking at it as your community. And they
Yep.
potentially, like you just said, could be
Right.
your neighbor. So why not try to do some good here?
Right.
Now, there are people out there that are like, okay, you commit murder. Yeah, people make mistakes. People steal.
Mhm.
People do drugs, commit a crime. Well, they were on drugs. Let's give
Yeah.
them a second chance. There are people out there, a majority of the population that say sex offenders, absolutely not.
Oh, right. 100%. You'd be surprised how many sex offenses are out there. The thing is that all sex offenses are looked at the same. Now, I know that sounds kind of crazy to say that, but
Yeah.
you can have an 18-year-old who had a 15-year-old girlfriend,
It's a senior and a freshman in high school.
senior and freshman in high
That
school.
happened in my high school.
Yep. Oh, mine too. Well, mine was decades ago, but that still happened in my kids' high
was
school.
10 years ago.
It was 10. Yeah.
One
We'll
decade.
go there. Yeah. 10 years in one day. But yes, that happens in high school. And we did have people that were incarcerated for that. And then they are also on the registry for lifetime,
Yeah.
right? Because of something they did when they were 18 or 19 years old. But that person is looked at the exact same way to the general public as somebody else. Anybody on the registry is looked at the same. Oh, this guy's on the registry. Oh, and I'm not minimizing crime. I'm just saying there's no way to differentiate this crime or this crime to the general public. It's all the same.
Yeah.
So, but I got to see the varying degrees of criminal behavior and crime, especially with sexual crime.
And with sexual crimes, it's usually like they were abused when they were younger,
The
or
majority of the time, yes.
so it's like, and I am not justifying anything. I'm just trying to understand it,
Right.
because you saw it from a professional standpoint. It's not fascinating. That's the wrong word, but it's like people want to understand why people are doing that.
Yeah, I think people want to understand why people do what they do. And so they look to psychology as the answer. Like,
Right.
you know the answers. I'm like, I don't know the answers. Nobody really knows the answers of why somebody does what they do. One of the responses would be, traumatic history, right? So either they were sexually abused. That's not a slam dunk either. Just because you've been sexually abused as a person does not mean that you will commit sex crimes later. I want to make
Right.
sure that that's clear.
Yep.
But the majority of the time, there's some type of an abuse, right? Physical or sexual. I go back to that first initial group because it was just so profound to me. And the psychologist running the group had asked, like, all of you guys in here, have you been physically abused? Nobody raised their hands. Nobody. And then so she started talking about, like, what was punishment like as a child? I'll never forget this one guy. He said, well, my dad would throw wrenches at my head, like literal mechanic wrenches. And he would have to dodge the wrenches coming at him. And we're like, that's abusive behavior. It is. They have no idea because that's just where they're living, right? That's their experience. So the majority of them sitting in there had no idea of the abuse that they endured, nor is it my job to dig up abuse or, create or fabricate abuse for them. But when someone says, like, yeah, when my dad would be mad at me, he would throw wrenches and other mechanic type equipment at me.
They're normalizing traumatic experiences, thinking it's normal.
Right.
That's how you raise a kid. That's how you discipline a kid.
Yes.
Yeah.
Yeah.
How many years did you do in total in the Department of Corrections?
In total, I think it was probably between 7 and 8 in total. Yeah. From practicum all the way until my exit point.
What was the wildest thing that you ever, I'm sure you have plenty of them, but what is one of the top ones that comes to mind?
The wildest thing. So after that, I still worked in maximum security for a while, and then we moved, and so then I got a job at the it's like a hybrid location for Department of Corrections and Health and Human Services in the state that I was in. And it dealt with the most mentally ill inmates in the state. Now, when you think about mental illness in the Department of Corrections, it's also guys who couldn't acclimate. They couldn't stay in general population for very long. In the prison system, they were constantly in segregation and things like that. So they would come to us, okay? And we called it the mechanic shop. So they would come to us and we would tweak them and do things and then send them back, right? They never stayed with us permanently. But there was so much self-injury going on there with guys. It was, at the time I was there, it was all men. Now it's men and women. But as I was leaving, the women were coming in. So my experience was all men. And the self-injury while incarcerated was profound. And because they didn't do this type of self-injury before they were incarcerated, nor after, okay? So they were only doing it while they were there. So we're talking about, like, as far as crazy stuff goes, just the lengths that these guys would go to either go to a hospital, go to segregation so they could be alone and not have a roommate, or the lengths that the guys would go to that were in other corrections facilities to get to us, right? Because our facility was viewed as like the spa. It was not a spa. It was the same cement block walls, whatever.
It's the nicest one
It's the
of,
nicest
yeah.
one. If you were in maximum security, and then you came to us, you had a lot more personal freedom.
Mm.
So a lot of the guys in Max would try, to fake mental health or do things, outlandish things to get to us, and it would work a lot of the times.
Mm.
But the self-injury stuff, like I definitely have traumatic things that I've seen as witnessing things, to the point where when I ended my career, like I don't know if you've ever heard of like hypnagogic dreams. It's like when you're half awake and half asleep. Like, yeah, I would see these guys in my closet. Like, I would be half awake and half asleep, and I would visualize them in there doing the self injury that I saw. And that freaked me the F out. But that didn't happen until I left. And I think about that a lot. Like, I think my body was at a place where it's like finally I could like breathe again, having left. And now it was processing all the traumatic shit that I had seen and went through. Um, One of my last days in that setting, God, I got a crisis call and we're walking down the hallway and there's blood streaming underneath the cell door. And the person inside this is going to be graphic. The person inside was literally had sliced their arm open and was spraying it all over the walls. And, they call in psych services, right? And he was assigned to my caseload, and my job was to talk him down enough to stop doing that so the guards could come in and help him. Yeah.
Oh my
Mhm.
God.
Yeah.
So you are no longer in the Department of Corrections.
No.
You're in this relaxed state. You're now starting to process everything over the
Yeah.
past 7-8 years.
Mhm.
Is this when you start getting on SSRIs and
No.
medication?
No, the SSRI stuff
Was later on.
earlier.
Oh.
So it was crazy. So earlier, so I was put on an SSRI as a preventative. Keep in mind, that's not a thing. A preventative for postpartum depression with my last child. I was put on
Mm.
it in the third trimester. And this was before. So remember, I started when my last child was 1. So
Mhm.
I was put on it while I was still in the daycare and being a daycare teacher. And I hadn't gone back for therapy school or anything, mental health education yet. So I was put on it as a preventative because with my child before that, I had some postpartum depression. And it started off, the conversation was simple. It was at the OBGYN office. And it was simple. Do you think you had postpartum depression with your last pregnancy? And I said, I'm pretty sure I did. Well, we can offer you sertraline, so Zoloft. We can offer you this, so maybe you won't get it this time. And it seemed reasonable, right? Like
Mhm.
that seems reasonable because I remember what it felt like to have some postpartum stuff. Um, and yeah, so I took it, and it caused some birth-related issues. It caused some things that nobody told me that it could cause, right? And, afterwards, I was like, "Okay, so I'm done being pregnant. I have a one-year-old, whatever. The postpartum period is over." And I was feeling terrible, by the way. I was feeling that flattened, low, disconnected to
Mhm.
family, disconnected to my husband, disconnected to my kids. I felt like I was, like, floating through life, like, just kind of existing here. And I would tell her that. And like, I just kind of feel this low energy. And every time I would tell her that, she would want to up the dose, right? Because the solution is not to get off of it. The solution is more, right? Probably how you got on 2 psych meds yourself, right?
Mhm.
My guess is you didn't start off on 2, you ended up on 2 because of
Mhm.
whatever you said or
In a lower
whatever.
dosage and it went
And then
up.
we'll lower and higher doses, right? So, yeah, so I was on that, and so I couldn't get off of it, and every time after a couple of years, I was like, all right, I got to get off of this. I knew inherently that it was messing up my life and I just wasn't feeling. And so keep in mind, I'm also going through school and I went through the practicum on SSRIs. In retrospect, probably helped me,
Mm-hmm.
in a certain way to not connect emotionally in those circumstances. Um, anyway, so every month with the refill coming in, I'd be like, all right, this is the month. This is it. I'm going to stop because there was no off ramp for me, this was 22 years ago when I was thinking about all this stuff. And there still is not an off ramp for people. Like 20 some years later, it's
Mm-hmm.
the people still exist in these same spaces. So I would try not to refill my prescription, right? And then I would get sick,
Yeah.
right? Like within 24 hours. And then I couldn't function. So then what did I do? Well, would either ask a friend for help that I knew was on the same thing because it would be like Sunday and the
Mm-hmm.
pharmacists are closed. Like I literally felt like an addict during these times. Like
Mm.
if any description would be that, like I'm dope sick and I'm searching for friends to give me a hit, right? Like
Yeah.
that's the way I felt. And I would tell my husband, like, I feel like an addict, right? With this. And as soon as I could get the prescription, I would get it refilled. And that would continue and continue and continue. Well, in we ended up moving because my husband had lost his job and we had complete financial devastation for 2 years. It was a very difficult time for us. And he got a job and we moved. And this was at a time where telehealth didn't exist. So I lost my prescriber. And I thought, glory days, this is so good. Like I don't have to worry about this anymore. So I did what everybody should not do is cold turkeyed my way off of it while I was then again working at the state. So yes. So that's what I did. Now, I think about this as everything kind of came together because the place I was working was very into health and wellness. Like we had rec therapists, we had a gym that the staff could use, and I had a office mate who was very much into running and things like that, and she got me into this. And so I'm starting on this really big health journey, right? And I feel like doing that simultaneously with the cold turkeying is probably what helped me the most because I was working on my health and wellness at the exact same time. So I would guess that that was one of the reasons why, my journey off wasn't nearly as devastating as many people that we have today. But, and it could also just be genetics,
Mm.
um, and time on, because now we've got people on for 20, 30, 40 years
Mm.
and trying to get off of SSRIs is excruciating neurological disorders, akathisia, all that. I didn't experience any of that. I experienced a lot of sickness, headaches, sickness, brain zaps, nausea, can't sleep. All
Mm.
of that's what I experienced. Yeah.
Yeah.
hmm
Okay, so let's go back to, you leave Department of Corrections. When do you get into addiction?
Oh, so while I was in corrections, I was also into addiction. So that state department that I was talking about, my next development in the state was I was the clinical director for a drug and alcohol correction center.
Oh, wow.
Right. For a short amount of time because ethically, I felt like I couldn't stay there anymore. The way that they were treating the inmates there, and these guys were like 5, 6 DUIs, that type of crime. These guys weren't there for massive, big crimes, right? They were there because I'm not downplaying DUIs because they can be
They
very
had a
deadly.
problem.
Yes, and so most of it was multiple DUIs, right? This is why they were there. They were treated like babies. They were treated like infants. They were treated like toddlers. They would get put in timeout tables. They would get reprimanded, like verbally reprimanded by the clinical supervisors. Not me, because I refused to do it.
Mm.
I took away the timeout tables, and all I did was get staff upheaval. They were so pissed off at me. Um, Launched a whole investigation on the state, and I launched the investigation, and I left because I said, "I can't stay here." They asked me if I would come back when the investigation was over, and I said, "Absolutely not." Mhm.
So they launched an investigation on the state. What ended up
Mhm.
happening with that?
It took 5 years for it to be resolved, And so one of the big players was just terminated at about 5 years later.
Or asked to step down.
Correct. Or
Yeah.
retired
Yeah.
or whatever, whatever it is. But I knew that I couldn't exert the change needed there. Like the systems are too massive, right? They're just too big.
Yeah.
I couldn't exert the change that was needed. And I felt like I did what I could while I was there. And it was interesting because before I got that position, I had just said to my husband when I applied, it took like 6 months to get hired. It took forever to be hired. I said, well, I'm either going to get this position or I'm going to go into private practice. And it was literally that week that they called and said, you got the position. I was like, well, okay, I guess I'm not going into private practice. And in less than a year later, went into private practice. So I've been in private practice fully since 2012.
What has that been like?
It's been amazing. It's so very different, but yet it is also very similar. The amount of trauma that I see, the amount of people struggling on psychiatric medications is profound. And these are things that I started learning like in 2012, 2013. Because I would look at my clients that were coming in, mostly women at that time, and they were on some cocktail of psych meds, right? And they were just not in good moods. They were just telling me how terrible things are for them. And, I was a very good steward to psychiatry in my previous jobs because that's what we did. We worked hand in hand with psychiatry. And it started dawning on me, that maybe the psych meds were the problem. And that launched for me a whole, cocktail, if you will, or smorgasbord of education. So I started re-educating myself on, this seems so stupid, like, how can you help the brain naturally, right? I'm a therapist. Like we never learned about how to support a neurotransmitter with nutrition or lifestyle. Even in the addiction world, what's the one neurotransmitter everybody talks about in the addiction world? Dopamine. You must have a dopamine problem, right? And with depression, you must have a serotonin problem. It's not that simplistic. And as a matter of fact, we now know the chemical imbalance theory is a whole load of BS. But so I started really looking at like, how do you support the health of someone's brain, right? How do you do this? And then I went back to nutrition school, and then I took all these continuing ed hours, I was like just absorbing all this stuff. And then I got into functional medicine. And I got into all these areas that as a therapist, I was never introduced to ever. Started doing more with psychopharmacology, right? All of these things. Like I just couldn't get enough of education. I still can't get enough of it. It's kind of my thing. But anyway, yeah. So, but when I was looking at people, I just kept thinking like there has to be more than just talking through problems, right? Like you're not deficient in talking, right? Something's going on in your life that's making you deficient. And as we start learning, these psychiatric medications deplete essential nutrients and they change how your brain chemistry functions. And again, people say, well, that's the point. I'm like, well, is it? Because it dials down your receptor sites and very similar to what drugs do, similar but yet different. But they change how the neurons communicate. Is that what we really need? Is a change forever in how your neurons communicate? Eventually, it will deplete you of your serotonin. Eventually, it will deplete your dopamine, which is why you start feeling down, low. It's called anhedonia, this just flat look in your face and just inability to attach emotions and things like that. So, yeah, which is why people end up on more stuff. You see the commercials, right? Add this one on and you're going to feel better, right?
Oh, man, those commercials, very deceiving.
Yeah, they're the worst.
They don't allow that in Europe.
I know. They need to not allow that here.
Don't allow that.
I'm all about getting rid of psych med commercials or med commercials. I'm all about it. When Big Pharma, what did they say? They spend like 3 times more on marketing than they do on research and development.
Yeah, it's insane.
Insanity.
I used to work in advertising sales. I used to see the Big Pharma commercials.
Crazy.
It's Pfizer.
Oh yeah,
It's crazy. You said, and I don't want to. I want to go back. You said the chemical imbalance is not a thing.
It's not a thing.
Can you explain your theory on that?
It's not my theory. It's research. So it has never, okay, everybody listening, it has never been proven, okay? It originated as a big pharma marketing slogan. This will correct your chemical imbalance. That's how it started back in like the mid 90s somewhere, right? When Prozac became a big thing, that's how they were marketing all of these psychiatric medications as it's going to correct a chemical imbalance in your brain. Okay. That carried on forever. Research never supported that ever. Okay. Which is fascinating to me because it is still prescribed like that. People, mostly the consumers, believe that it's correcting a chemical imbalance in their brain. That has never been supported. In 2022, there was a landmark meta analysis, which is a collection of many research articles that then they re-researched, right? In 2022, it was done in the UK by Joanna Moncrief and a bunch of other really brilliant people to finally either say, yes, it's a thing, or no, it's not. And what do you think they found out?
No.
No, absolutely it is not. And that was just in 2022. That was recent. Right. And so many people felt betrayed, right? Because being prescribed, because it was like you were born with a broken brain. This is not that dissimilar to the addiction side of things, right?
Mhm.
Your brain is broken. Well, was your brain broken before you started using meds or drugs or alcohol? Or did it change because of the meds, drugs, and alcohol? And so now the chemical imbalance theory is true under one circumstance.
You made it
After.
happen.
After.
Right.
Yes, after. Mhm.
That's one hell of a marketing
And it
campaign.
went on forever, and it still is today. People are still arguing about it, right? And I'm like, could you just read some research about this finally and realize that it is not a thing. It is not why you were prescribed. And so I'll still get people like, but I'm the one that I do have a broken brain. And I'm like, you're not though. Like
Yeah.
you're not the outlier here. Like everyone wants to be the reason why. But I think that's probably because getting off of it is so hard. So when you try to have that off ramp and you suddenly are more depressed than you were before, more anxious, more overwhelmed, the assumption is return of symptoms.
Mm.
You need this, right? Well, really what that is withdrawal. Yeah. That's all that it is. So it's the dependency of the medication you're now dependent on. Yeah.
Do you see a lot of Suboxone use?
I don't in my practice,
Mhm.
because that's not the clientele that I work with, so, yeah.
Okay. I would
Mhm.
like your feedback though on,
I'll try.
do you think our society is not manning up enough in terms of getting on Suboxone and staying on it for 10 years,
Forever.
10 plus, forever?
There's so much fear around Suboxone, methadone clinics, all of that, so much fear to get off. They're being sold the same bill of goods as we were with psychiatric medication. You need this forever so that you can stay sober. You need this forever so that you can not be depressed or anxious. Like this being sold this idea, I man up. I mean, that's a pretty big statement. I think bamboozled might be a better statement
Mm.
into believing that your brain is so effing broken that you need this for the rest of your life and everyone around you should be afraid if you're off of it. That's the exact same message of psychiatric medication, in my opinion. But here we go again. Like, is there long-term research outcomes for someone who's been on Suboxone for 20 years? What does it do to their brain? There is no long-term research studies that show outcomes are good. So, same thing with psychiatric medications. There's literally maybe a few, but there's literally no long-term outcomes that show positive impact of your brain or body after 20, 30 years. So let me put this in perspective. If you smoke one cigarette once a month for 2 months or 3 months, one cigarette, okay? Do you think your body is metabolically going to change
No.
that much? No. But if you smoke a pack a day every day for 20 years, do you think your body is going to metabolically change? Yes. Anytime you put something in your body constantly, every day, over time, metabolically, it will change. Physiologically, it will change to the negative. Okay. So when we think about this, there are some new reemerging studies about SSRIs and benzodiazepines and other classifications of psychiatric medication, um, precursing dementia and Alzheimer's disease. So this is that you can't get something for nothing. There is going to be a trade off in the future for you. Are you ready for that trade off? Did you know that trade off existed when you got on it? The answer to that is I did not. The answer to that is none of my clients did either until you're there. And now I have a huge influx of clients, 60 years old plus, feverishly trying to get off of their psychiatric medications now because they're so afraid of Alzheimer's and dementia risk
Mm.
and cognitive decline overall. But I would imagine that it would be a very similar conversation with people on Suboxone or methadone for the long haul.
Do you see any psychosis, like marijuana psychosis?
Marijuana psychosis, 100%.
What is your take on that? What are some of the cases? Is it a younger demographic? Is it older? Is it all over the place?
I've seen it a few times in younger people for sure. It's what I've seen is typically the person that's doing it every day, and they're kind of reliant on it every day. It's really strange because one of the ones that I recently had, I think the person was around 30 years old, every day, doing it a lot toward the end, and ended up running the streets of the community that I'm in, so and got picked up by the cops and thrown into inpatient, things like that. And then suddenly it was because they were psychotic, they got labeled as bipolar 1, right? And they said, "Well, this is just the time of year, like, this is just not the time of year, but the time of your life where it came out, just happened to come out now." And I'm like, "Or it's all the weed they were smoking, for days on end, and they got into a place of psychotic behavior. And now, guess what happens? Well, you know what happens when you get put into inpatient? You get on a stack med cocktail, right? And now you're off of that. You're taking your psychiatric medications and you believe that you have bipolar disorder. But guess
Mm,
what you're going to do now? Start smoking weed again.
yeah.
Mhm.
How long do you see a lot across the board? And I know it's different with every drug or
Mhm.
substance, alcohol, whatever.
Sure.
Um, one of the biggest questions, the most commonly asked question that I get is, when am I going to feel normal again after I get off of drugs and alcohol?
Oh, yeah.
And for me, I hate to say this, and I hate newcomers to
Mhm.
hear this, but it took like 6 to 9 months for me to start genuinely feeling happiness
Yeah.
and empathy and all those feelings.
Yeah.
What do you see?
Well, again, that depends on the person. I will give you some examples. For me personally, because in retrospect, I've had to go back and really think through all this. When did I start feeling like me again after I was off the SSRIs? And I tell people it's probably between year 1 and 2. Okay. And that was me working on the foundational pieces of my life at the same time. So if you're someone and you're coming off of meds or drugs or whatever it is, work on the foundational pieces of your life: nutrition, sleep, movement, meditation, stress management. Work on that and it will come around faster. If you don't, and you're just sitting there still eating your terrible diets and trying to white knuckle your way through everything, it's probably going to take longer. And I forgot the last one would be connect with people, like have loving
Mm,
relationships with people. It's profound. This is all person dependent. Now, I don't know. I think the average age of recovery in addiction space is like 29, 30 years old. I believe that's the average age. Now, if we put that in the psychiatric med world, someone on an SSRI, we'll just say, or even a kid who was put on a stimulant when they were 6, they're on that medication or drug for way longer than typical people use drugs and alcohol, right? We're talking 20, 30, 40 years. Most people aren't using drugs and alcohol for that long. I say most, some people do. So the longer term impact is going to mean a longer recovery period.
Mm.
Now, some people on SSRIs, this is the rule of thumb because I help people get off SSRIs as well with the help of their prescriber. I tell them to manage expectations to get off of something safely is 1 to 3 months for every year you've been on it. So if you've been on an SSRI for a year, it could take you up to 3 months to get off of that, not a couple of weeks or a day, none of that. Okay. And for some people, so I have a podcast too, and my co-host is now 3 years tapering off of her SSRI in year number 3. So, and she still has probably another year to go.
Mhm.
So, how long is it going to take then? So it takes that long to get off. And then you have to recalibrate your brain once you're off. So probably another year or so later.
So if you've been using drugs for 10 years,
Mhm.
30 months.
Yeah.
Whew,
Mhm.
damn.
Yeah.
Well, all right. Well, then I will give someone a little hope out there. I was on drugs for 10 years and
Yeah.
it took me probably 6 to 9 months. So
Yeah.
I was on the lower end
Yeah.
of
Well,
that spectrum.
that's the spectrum, right?
Yeah, of
Like
course, of
you're
course.
you're an individual person and I don't know what your lifestyle is like and I don't know how you changed your life, right?
Yeah.
That's all important information.
Yeah.
No one person is the same, which is why I say 1 to 3 months, right? Like so we can
Mhm.
manage the expectation. But if you go into rehab or you go into detox, how long does it take for them to detox you off of, let's say, heroin?
A week?
Okay, look at an SSRI. What did I just tell you?
Your co-host for almost 4 years, it'll probably be.
Yep.
In total.
Mm-hmm.
Yeah.
Yeah. So that's the difference. And so if we want to talk slightly about the whole RFK Jr. thing, when he made that announcement and he said, heroin was easier to get off than an SSRI, and everyone freaked the fuck out. And they're like, well, heroin and SSRIs are different. He didn't say they weren't different. He said SSRIs are harder to get off of than heroin. It takes you a week to get off of heroin. You might feel sick, right? You might feel pretty terrible during that week, but you're not going to have akathisia after, which is that internal restlessness that causes people to take their lives.
Mm.
You're not going to have anhedonia. You're not going to have PSSD. You're not going to have all these things. You're not going to have 4-year taper plan, right, to get off of heroin or meth or whatever.
Yeah.
Now, alcohol is a little bit different. They still detox you quickly, but they do that in combination with other psychiatric medications so that you don't die,
Mhm.
right? So,
But there's no comparison there
There's
from
no
alcohol
comparison.
to SSRIs.
right.
So
The
for
dependency is the deal, because this
Yeah.
is serious dependency.
Yeah.
Mhm.
So for the people that do get sober under your care,
Mhm.
and there are a lot of them, all of them, what are some tools that they implement? What tools do you see used most commonly with people that are staying sober?
The first tool is food. And I know that seems like a weird thing to say, but nutrition is medicine here, because many people that come in, whether they're addicted to something or they're depressed or anxious, are not eating enough protein. They're not drinking enough water. They're not doing foundational things. They're not having omega-3 fatty acids in their life. So the biggest tool is feeding your brain. That is tool number 1. Like I mentioned, the 4 big pillars of mental health, those are all tools too. Eat, sleep, move, meditate, all tools. Connect with friends and family, all tools. And then, you're probably going to want to look at, now this isn't 100% all the time, but, traumatic events in your life. And so you might consider using EMDR therapy or something like that, but you can't do that until you're stable enough to do
Mhm.
that because it can be destabilizing at the same time.
Yeah.
Mhm.
Pull your head out of the clouds,
Yeah. Mhm.
get stable, and then start doing the work.
Dig in.
Yeah.
Mhm. Yeah.
What is so you get people that stay sober and then you have people that relapse.
Mhm.
Have you had a lot of patients that have gotten sober, maybe stopped working with you and then came back because they relapsed?
Well, I'm not the panacea for anybody. I'm not the, end all be all for a person,
But you
right?
have a lot more experience than
I do.
most.
I do. I think you need to remember that the keys for sobriety are always within you as the person, and don't offload that to a provider of any sort. I Years ago, this was in the prison. I had the first client inmate who took his own life, and
Mm.
I took it really, really hard. And one of my colleagues said he was actually transferred out. He was transferred back into the general population at in the corrections. So he wasn't in the facility anymore. But I happened to be on vacation at the time that he did it. They transferred him out while I was gone, and then I came back and he had taken his life. Actually, I found out while I was on vacation. I took it really hard. And my colleague said, she said, "You are nobody's life support. And if you view yourself as life support, you're going to have trouble because you're going to establish a sense of codependency with that person. They're going to be codependent on you for their life support." And I remember that and I keep that in mind always. I'm nobody's life support. You are your own life support. However, can I be someone's support? Absolutely. And I think, when there's a relapse that has happened, because it happens a lot. There's a lot of shame involved in relapsing too, because let's say you're my client, right? And you're doing so good, and then you're released and released from care, and then you don't do so good. What are the odds of you coming back and saying, "I'm not doing so good"?
Not high at all.
Right, because why? Because we have this relationship
Yeah.
and now you're embarrassed and ashamed and all these things, right? So it's hard to come back. Luckily, I've had several people actually come back.
Mm.
And so getting them out of the place of shame, I think is probably one of the most important pieces. I was taught this years ago. I had a fabulous clinical director many years ago, and she said, "It doesn't matter the therapeutic intervention. It doesn't matter like the modality, the EMDR, DBT, CBT, all the lettered therapies. That is irrelevant to the relationship that you form with your client. The relationship that you form with your client, the therapeutic relationship that you form with your client, is the biggest predictor of change and outcomes." And that goes back to our earliest statement when I said I treat them with dignity and care so that when they're in the community that they can function as part of the community. That's the therapeutic relationship that we're talking about that changes people.
Mm.
Yeah. So,
I had probably from my first meeting that I went to when I actually got sober, there was probably, it was, I want to say 8 or 9 years ish.
yeah.
And I had tried coming into the rooms, getting sober. I'd get sober for a couple months. There were probably 100 relapses. The guilt and shame,
Mhm.
that's what kept me out.
Yeah.
If you
Oh,
just
yeah.
removed guilt and shame,
You
I
could
probably would have gotten sober way earlier.
100%.
It's crazy.
Mhm. But that's because it's not, you think you're doing it then for somebody else, that somebody's gonna be so upset with you or something that
Yeah.
you messed up or whatever. But you have to remember you're doing this for yourself.
Mhm.
I think my husband, who's 32, 33 years sober this summer, I believe. Um, I've asked him, like, "How many times did you try to get sober?" And he said, "So many I lost count," is basically
Mhm.
what he says. And so even down to his sobriety date, he doesn't keep track of because there was so many tries, before that and failures, so to speak, that it just kind of naturally stuck at one point for him. So,
Yeah.
yeah.
Can you actually talk a little bit about what it's like to be the wife of a recovering alcoholic? He's got a lot of time,
Yep.
in his 30s.
Yeah.
Um,
Mhm.
what is that like, and how do you support someone that
Mm.
is a spouse that's in recovery?
It was interesting because when we met, I thought he had more sobriety than he did. I didn't think I actually asked him out on a date and I said, "Hey, do you want to go get a drink?" Okay, now keep in mind I'm in my mid 20s at this point and I think he was 29. And I said, "Do you want to get a drink?" Because we used to work together. And he goes, "I don't drink." Like I was like, "I don't drink, but I do drink coffee." And I said, "Great, let's go do that." Okay. So that was kind of how it all started. I was young and naive and I had no idea what this would mean in my life. What I knew was I wasn't a drinker at the time anyway. I had gone through my partying days, of course. But at that point in my life, it wasn't something that I was seeking,
Mhm.
And so those early days were tough. I remember watching him struggle, and I remember him, um, just telling me that he wishes he could go to a bar and drink, but he didn't, and it was rough. Again, I was in my 20s when this was all going on, and I was starry eyed and in love and all the things. And we talk about him being in recovery, and I always say, like, you're just living your life. Like, you're living your best life right now. He had come off of a marriage before that, and he had lost a son. And when he was, I think 14 or 15, his father had died. So he's been through so many tragic things that I had never encountered in my life.
Mm.
I had a lot of compassion for him going into that space. But then we started building our life together and things got good. And I distinctly remember going out to dinner in the early days and I said, "Would you mind if I had a drink?" And he goes, "I'm the one with the problem, not you." And I think in the course of our marriage, I probably have had 3 drinks we've been married for 31 years this summer. So I'm like, it has never really been a part of our life, and that has been a big choice. And so I always jokingly said to our kids and things like, when you have friends over, their parents don't have to worry because there is no drinking here. There's no alcohol
Mm.
in our cupboards. There's no nothing for them to worry about at our house. It just became a natural way to live. And it's always fascinating to me because we're from Wisconsin. So, there's big drinking culture in Wisconsin.
Mhm.
And people would be like, do how do you do life in Wisconsin without drinking? And I'm like, because it's not if you're choosing to go camping because you can get shit-faced around a campfire, then maybe you're not choosing to go camping for the right reasons. So,
Mhm.
we camped, we did everything with no alcohol, and I feel like we taught our kids a valuable lesson that you didn't need to do that to have a good time or to have a family. But what's it like to be a spouse with a spouse in recovery for this long? I don't know, I feel like you just have to love each other. He I think he endured more with me on SSRIs than I had ever endured with him in recovery
Mm.
because I was so disconnected to him during that time. I wanted a divorce. I wanted to leave. I didn't feel like I was connected to anyone or anything, and he refused to quit on me. And
Wow.
so I feel like he had more to go through with me than I have ever gone through with him.
I have
Yeah.
goosebumps. That's beautiful.
Mhm.
That's
Yeah. He's
amazing.
a good guy. Mhm.
Yeah. He's right
Yeah,
next to
no,
me,
he's right
looking
there.
right
He's a
at.
really good guy.
He's shaking his head no. I love it. I love it.
Yeah.
That's a beautiful story. That's
Mhm.
a beautiful relationship in a
Yeah.
marriage. And I feel like today I'm a product of it. People quit on marriages very
Mhm.
easily.
They do.
And that builds a much stronger relationship between you two.
That's the hope.
And your kids feel
Yes.
that. And see,
Mhm.
how are your kids doing today?
Good. Our kids are really good. So they're all older now, so we're empty nesters. Our last one
I
is
can't wait for that day.
our no. Our last one's gonna be moving out in July. So, yeah, so they're doing really well, and I think we've created a really good family. So, yeah, it's
That's
good.
amazing.
Yeah,
I just wanted
it's good.
to secretly find out how they turned out,
Yeah.
given the no drinking, because that's how I raised my daughter. I mean,
Yes.
she's still young, but she's going to go through her
It
teenage
just
phase.
becomes like a normal, it's just normalized in your house. Like it's
Yeah.
just what you do or what you don't do. It wasn't like they were ever missing it, because they'd never had it. So you don't miss something that you don't have.
Hmm.
And I think while they're as adults, they can make whatever decision they want. But while they're being raised, like it actually takes away the pressure too,
Yeah, of
right?
course.
So,
And you're showing them
mhm,
what it's like to go camping and just
right,
naturally have fun,
right,
be happy, laugh,
hmm,
create memories.
right.
You're
All the
showing them
things.
that side.
Hmm.
That's the most important thing.
Yeah,
So you have a podcast.
I do.
What's the name of your podcast?
It's called the Gaslit Truth
I
Podcast.
love it.
And it's so Jen and I, my podcast co-host, we worked together in the prison system, and now she works with me at my private practice clinic. And we would be on the phone for hours talking about all the shitty things we said and did, and around psychiatric medications, like the manipulative language we would use, like to keep someone med compliant, right? Like,
Mm,
it's just like a diabetic taking insulin. No, it is not. It is not. Like these are, or would you rather, gain a little weight and not be depressed? I'm like, dude, like you tell me
mm,
to gain more weight and I wouldn't be depressed? I don't think so. Like we said a lot of things. So one of our first episodes was called The Dirty 30. And the Dirty 30 was the 30 manipulative things that we had said for medication compliance, or we have heard other people tell us for med compliance reasons and things like that, that are nowhere near informed consent. And we did that as kind of it was funny, but it was also kind of reparative for us to say those things out loud,
mm,
because otherwise I felt like a bit of a hypocrite going around talking about psych meds bad, which they're not bad all the time, right? Like there are
mhm,
some reasons to have them, but I'm like, I got to clean up some of my past here because of how I used to practice, and so we're doing that through the Gaslit Truth podcast. Yeah.
I love that. Where
Mhm.
can people find it?
Anywhere you listen to podcasts, and
YouTube,
YouTube,
Apple,
Apple,
Spotify, the
Spotify,
whole nine.
the whole 9.
When
Yeah.
did you guys start it?
Oh gosh, 2.5 years ago, I think.
That's amazing.
Yeah.
That's
Mhm.
amazing. Where can people find you if they want to get in contact with you?
Easy. I'm across all social media under Dr. Teralyn, but also just drteralyn.com.
I love
Mhm.
that. Well,
Yeah.
I want to thank you for coming on.
Sure. I could
This was
talk way more, but anyway.
very informative, and I appreciate even the vulnerability about your journey with SSRIs
Mhm. Yeah.
and what you went through, because it's a very important message that we need to put out there.
Mhm.
Um, and I appreciate you being honest with us and
Yeah.
the work that you are doing.
Thank you so much. I am glad to have finally gotten here to share
Yeah.
the stories. So,
Thank you again.
yeah.